Welcome to another episode from the Veterinary Medicine Digest. Today, we are delving into a field that operates at the intersection of veterinary medicine, pathology, and the law. It is a discipline that speaks for those who cannot speak for themselves, seeking truth from the silent evidence left behind in cases of animal injury, neglect, and death. We are talking about the world of veterinary forensics. For as long as veterinarians have applied their scientific knowledge to legal questions, veterinary forensics has existed. But in recent years, this field has seen a rapid expansion. There is a growing public and legal interest in prosecuting crimes against animals, fueled in part by the scientifically established link between animal abuse and other forms of interpersonal violence, including domestic violence and child abuse. Cases involving suspected animal abuse and neglect are being submitted to veterinary diagnostic laboratories with increasing frequency. This has created a greater demand for veterinary specialists to assist courts in understanding the evidence presented in these often complex and tragic situations. So, what exactly do we mean by animal abuse and neglect? While the specific legal definitions can vary between jurisdictions, in general, animal abuse is considered an act of commission, something actively done to an animal that often gives the perpetrator satisfaction. This can include physical trauma, sexual abuse, or organized activities like dogfighting. Animal neglect, on the other hand, is typically an act of omission, where a person fails to provide an animal with the basic necessities of life, such as food, water, shelter, or veterinary care. In this episode, we will explore the multifaceted role of the veterinary professional in these investigations. We will start by defining the crucial role of the veterinary forensic pathologist and the meticulous process of a forensic necropsy. Then, we will journey through the different types of evidence they uncover, looking at everything from what advanced imaging can reveal, to the stories told by blunt trauma, sharp injuries, thermal damage, and the tragic signs of asphyxia and drowning. It is a difficult topic, but a vital one. By understanding the science, we can better serve both the animals and the communities we are a part of. The work of a veterinary forensic pathologist is fundamentally different from that of a standard diagnostic pathologist, even though they use many of the same skills. In a typical diagnostic case, the primary question is, what disease process caused this animal's death? But in a forensic case, the questions are posed by the legal system. The pathologist's role is not to determine if a crime was committed, that is the duty of the judge or jury. Instead, their duty is to act as an expert witness, assisting the court in understanding the scientific evidence. This means their entire process, from the post-mortem examination to the final written report, must be modified to anticipate and address the needs of the court. This process begins with the forensic necropsy. The body of the animal is not just a carcass, it is a critical piece of evidence. Because a necropsy is a one-time event, it must be performed with immense forethought and meticulous documentation. Before the examination even begins, it is considered best practice to obtain whole-body radiographs. This simple step can reveal hidden metallic objects like bullets or microchips for identification, as well as bony injuries like healed fractures that might indicate a history of trauma. Imaging is ideally done before the animal is even removed from the bag or blanket it arrived in, to ensure that any evidence that may have become dislodged, such as a projectile, is not lost. Photography is an indispensable component of the forensic necropsy. Photographs serve to document lesions, establish the identity of the animal, and are frequently submitted as evidence in court. Every lesion requires at least 2 photos, a distant view to show its location in relation to anatomical landmarks, and a close-up for detail, always including a scale and case number. The goal is to create objective images, with minimal gore, that a jury of laypeople can understand. The external examination is given paramount importance. A central concept in forensic science is Locard's exchange principle, which states that every contact leaves a trace. This trace evidence, be it the perpetrator's hair, deoxyribonucleic acid, or fibers from a weapon, is most often deposited on the outside of the body rather than within it. The pathologist will carefully inspect the entire body, paying special attention to the claws, teeth, ears, and genitalia for any trace evidence or signs of trauma. Injuries are often numbered and mapped onto a body diagram, which provides a clear, quick reference for the court. One of the primary goals of the post-mortem investigation is to determine the cause of death. In forensic pathology, this concept is broken down into several parts. The proximate or underlying cause of death is the specific disease or injury that started the chain of events leading to death. This is the "if it weren't for X, this animal would still be alive" moment. The mechanism of death is the altered physiology that the cause of death set in motion, such as organ failure or septicemia. For example, the cause of death might be a gunshot wound to the abdomen, while the mechanism of death is hypovolemic shock from hemorrhage. It is the cause of death that is of primary interest to the courts. These concepts require some adaptation for veterinary medicine, particularly in cases involving euthanasia. Euthanasia is almost always the immediate, but not the primary, cause of death. The primary cause is the underlying injury or illness that necessitated the act. Properly identifying this is crucial, as the legality of the case often hinges on whether criminal abuse or neglect was committed, regardless of the final outcome for the animal. It is also important to distinguish between humane euthanasia performed according to established guidelines and the simple, unlawful killing of an animal. Another unique aspect of forensic pathology is the importance of the scene where the death occurred. Information about the environment, such as the ambient temperature, the availability of food and water, or the presence of hazardous debris, can be crucial for interpreting the findings of the necropsy and establishing a credible cause of death. While veterinary pathologists rarely attend the scene themselves, collaboration with forensic veterinarians and law enforcement who do is vital. This multidisciplinary approach, sometimes even involving collaboration with human forensic pathologists, strengthens the investigation and the resulting opinions, regardless of the species involved. Now, before we delve into the physical evidence of trauma, let's explore a powerful set of tools that allows investigators to see inside a body without ever making an incision: forensic radiology and imaging. The use of imaging in legal investigations is almost as old as the technology itself. Radiography played a role in forensics almost immediately after the discovery of the X-ray image. One very early example in veterinary medicine was described by a Yale University professor, A.W. Wright, who is credited as the first American to produce a radiographic image. He radiographed a rabbit carcass he had bought at a market and discovered that round-shot projectiles were the previously unknown cause of death, using the image to guide their extraction. This early case highlights the fundamental value of imaging to reveal what the naked eye cannot see. Today, a range of imaging modalities, including radiography, ultrasonography, computed tomography, and magnetic resonance imaging, play important roles in the forensic investigation of both live and deceased animals. For living victims, imaging can help determine the presence of abuse or neglect, establish timelines for injuries by identifying fractures in different stages of healing, and locate projectiles. For deceased victims, post-mortem imaging is used to help determine the cause of death, identify the victim, and guide the traditional autopsy. However, interpreting post-mortem images requires a specialized skill set. The radiologist must be familiar with the normal changes that occur in the body after death. For example, they must understand the phenomenon of livor mortis, which is the sedimentation of blood in dependent areas of the body, and distinguish it from antemortem bruising. They must also be able to differentiate the normal gas that accumulates during putrefaction from pathological gas accumulations that might indicate an injury or infection. Positioning a deceased animal for imaging can also be a challenge due to rigor mortis, the temporary muscular contraction after death. This is one reason why cross-sectional imaging techniques like computed tomography are often preferred, as they allow for digital reconstructions from any angle, regardless of the body's initial position. Let's look at the specific modalities. Postmortem radiography is widely available in veterinary practice and is considered a standard of care in forensic evaluations. Obtaining whole-body, focused radiographs before an autopsy is crucial. Radiography is excellent for identifying abnormal accumulations of air, such as a collapsed lung or air in the abdomen, which might be missed during a necropsy. Its most common use, however, is to identify, locate, and describe projectile fragments. A radiograph acts as a map for the pathologist, guiding the retrieval of bullets during the necropsy and alerting them to potential hazards. Postmortem ultrasonography has its own set of advantages, chief among them being its portability. This allows for on-site imaging in situations like mass casualty events or large-scale animal cruelty investigations. It can be very useful for locating foreign objects or projectiles before an autopsy and is particularly valuable for guiding non-invasive tissue sampling, like a fine needle aspirate or biopsy. This technique is especially helpful when an owner has declined a full, invasive conventional autopsy but still wants answers. However, its use can be limited by post-mortem changes like gas accumulation and low body temperature. In human medicine, post-mortem computed tomography, or PMCT, has largely replaced conventional post-mortem radiography. While its use is less common in veterinary medicine, often due to cost and availability, it offers superior information. Given the challenges of positioning a body due to rigor mortis, the ability of computed tomography to create multiplanar and three-dimensional reconstructions is a significant advantage. A whole-body scan is typically performed before the animal is even removed from its body bag to serve as a baseline and detect any forensically significant material outside the body. One of the greatest benefits of post-mortem computed tomography is the opportunity to reevaluate the remains digitally as new information becomes available in an investigation, an advantage that a conventional autopsy simply does not offer. Advanced computed tomography techniques are also being explored. Post-mortem computed tomography angiography involves infusing a contrast agent into the blood vessels to allow for the evaluation of vascular disease, active bleeding, or anomalous vessels. Another technique, called ventilated post-mortem computed tomography, uses a portable ventilator to mimic a breath-hold technique during the scan. This helps distinguish normal post-mortem lung collapse from pathological changes like pulmonary contusion or pneumonia. Finally, we have post-mortem magnetic resonance imaging, or PMR. Its primary advantage is its superior soft tissue detail and contrast compared to computed tomography. This makes it particularly valuable in pediatric postmortem imaging in humans and for evaluating certain conditions in animals. Brain PMR can provide a critical evaluation of intracranial lesions before an invasive autopsy and can even be useful in later stages of decomposition when other methods fail. Cardiovascular PMR is of great interest because it can identify acute, subacute, and chronic heart attacks, which can be difficult to recognize on a traditional autopsy. Perhaps one of the most powerful forensic applications of postmortem magnetic resonance imaging is its ability to help differentiate antemortem trauma from postmortem injury. This is done by looking for evidence of a vital reaction. For example, skeletal trauma that occurs before death causes hemorrhage from torn capillaries within the bone, resulting in bone marrow edema. This edema shows up as a high-intensity signal on certain magnetic resonance sequences. The absence of this signal with skeletal trauma suggests a lack of a vital reaction, making a post-mortem injury more likely. This ability to differentiate when an injury occurred can be a critical piece of evidence in a legal investigation. Imaging provides a powerful, non-invasive window into the body, but the core of many forensic investigations lies in the careful examination of physical trauma. Let's now turn our attention to one of the most common findings: blunt force trauma. Blunt force trauma is the result of an impact between the body and an object or surface that is not sharp. Understanding the lesions it creates requires a grasp of basic physics. The damage inflicted depends on the kinetic energy transferred during the impact, which is a function of the object's mass and velocity. The severity of the injury is also influenced by the area over which the force is delivered, the time over which it is delivered, and the plasticity, or ability to deform, of the tissue being struck. In veterinary cases, identifying blunt trauma can be a significant challenge. The thick hair coat, pigmented skin, and differences in dermal structure of many animals can obscure or completely hide external injuries. This makes it absolutely essential for the pathologist to reflect the skin of the entire body to search for underlying evidence of trauma. Shaving the fur alone will rarely reveal all the injuries. Blunt trauma produces three main types of lesions: abrasions, contusions, and lacerations. First, an abrasion is an injury where the epidermis, the outermost layer of skin, is removed by friction or compression. We can classify abrasions based on how they were formed. A scrape abrasion, also called a brush abrasion, occurs when an object hits the body tangentially, scraping across the surface. These are very common in animals involved in motor vehicle accidents, and careful examination can sometimes reveal embedded material like asphalt or tire rubber. An impact abrasion occurs when an object hits the skin perpendicularly, and in animals, this is quite rare. More common are pattern abrasions, which reflect the shape of the object that caused the lesion. The most frequent examples in animals are nail abrasions from other animals during a fight, or even from human fingernails in cases of strangulation or sexual abuse. The second type of lesion is a contusion, more commonly known as a bruise. A bruise is an area of hemorrhage beneath intact skin, caused by the rupture of blood vessels from an impact. As we mentioned, in most domestic animals, bruises are rarely visible externally and are best identified after skinning the animal and examining the subcutaneous tissue. It is critical to differentiate a true traumatic contusion from other conditions that cause hemorrhage, like blood clotting disorders, and from livor mortis, the post-mortem pooling of blood. Traumatic bruises are generally localized and may be associated with other injuries like fractures, whereas livor mortis occurs in the dependent, or lowest, parts of the body after death. Like abrasions, contusions can sometimes form a pattern. A classic example is a tramline bruise, which appears as two parallel lines of hemorrhage with an undamaged area in the center, often caused by a strike with a cylindrical object like a pipe or stick. The third major lesion is a laceration, which is a tear in the tissue resulting from a crushing or stretching force. Lacerations typically occur where skin is stretched over a prominent bone, which acts like an anvil. Grossly, lacerations are characterized by irregular margins. Their single most defining feature is something called tissue bridging, where more resilient tissues like blood vessels or nerves remain intact and can be seen crossing the tear. This definitively distinguishes a laceration from an incised wound caused by a sharp object. The margins of a laceration are also often abraded or bruised, and the hairs around the wound will be crushed, not cleanly cut. In almost every case of trauma, the pathologist will be asked to help differentiate accidental injury from non-accidental injury. This can be incredibly difficult. While studies exist on the patterns of injury seen in accidental events like falls from heights or motor vehicle accidents, comprehensive studies directly comparing these to patterns of non-accidental injury are still lacking. Therefore, the pathologist must rely on the totality of the evidence, the case history, their own experience, the results of the post-mortem investigation, and the presence of findings that raise suspicion, such as multiple fractures of different ages in the same animal. While blunt trauma involves crushing and tearing forces, a different and distinct set of injuries is created by objects with a cutting edge. Let's now examine the world of sharp force trauma. Sharp force injuries are those caused by a mechanical force using sharp objects against the skin. These injuries are generally less common in animals than blunt force trauma or even poisoning. The instruments involved can range from knives, which are the most common, to axes, machetes, scissors, screwdrivers, broken glass, and even arrows. A thorough investigation of a suspicious death requires a crime scene investigation, and in cases of sharp trauma, bloodstain pattern analysis can be particularly informative. The shape, size, and distribution of bloodstains can help indicate the type of weapon used, the position of the victim and perpetrator, and even estimate the number of blows or stabs. A crucial first step for the pathologist is to differentiate sharp injuries from blunt force lacerations. Unlike a laceration, a sharp injury does not have ragged edges or soft tissue bridges crossing the wound. The edges are linear or angular, and bruising is rare. Sharp injuries are broadly classified into four main types based on the lesion pattern. The first is a stab wound, where the depth of the wound in the tissue is greater than its length on the skin. The shape of a stab wound is influenced by several factors, including the movement of the victim or the knife during the attack, which can create atypical patterns like Y-shaped or L-shaped lesions. The shape is also affected by the natural tension lines in the skin, known as Langer's lines. If a stab is perpendicular to these lines, the skin's elastic fibers will pull the edges apart, creating a gaping wound. If the stab is parallel to the lines, a narrow, slit-like wound is produced. The wound's characteristics can also offer clues about the weapon. The length of the wound on the skin, when the edges are reconnected, can provide an estimation of the blade's width. If the wound penetrates deeply enough, the hilt or guard of the knife may leave a mark or bruise on the skin, indicating the force of the thrust. The second type is an incised wound, also known as a cut or slash, where the length of the wound on the skin exceeds its depth. These wounds may show features that reveal the direction of the cut, as the terminal end of the wound is often more superficial. If the blade contacts the skin at an oblique angle, one margin of the wound will be beveled, while the other is undermined. In cases of wildlife crime, incised wounds are commonly inflicted on the neck to cause bleeding or at the site of a bullet wound to hide the entry point or remove the projectile. Third, we have chop wounds, which are produced by heavy instruments like axes, machetes, or meat cleavers. These create an incised wound on the skin, but are associated with underlying bone fractures or deep grooves in the bone. Axes tend to cause crushing of the bone, while machetes can produce smaller bony fragments. A similar type of injury is seen in marine animals struck by boat propellers, which can cause a combination of incised, chop, and even blunt force trauma. The fourth category is therapeutic or diagnostic wounds, which result from veterinary interventions like incisions or injections. Different sharp objects create unique wound patterns. Scissors can leave two stab wounds if used while open. A flathead screwdriver produces a slit-like wound with squared ends and abraded margins, while a Phillips screwdriver can create an X-shaped lesion. Arrows produce wounds that slice through tissue, in contrast to bullets, which tend to crush and tear. A key clue for an arrow wound is that the adjacent hair will have a sharp, even line of cut. Determining the cause of death in these cases depends on which organs or vessels are involved. Lesions in the neck and thorax are most likely to be fatal. The mechanism of death is frequently hypovolemic shock from hemorrhage, but it can also be asphyxiation from the aspiration of blood if the trachea is severed, or a collapsed lung if the chest is penetrated. Traumatic injuries, whether blunt or sharp, are often dramatic and visually compelling. But some of the most challenging forensic cases involve deaths with few, if any, external signs. These are deaths caused by asphyxia, a silent and complex process. In a forensic context, asphyxia refers to death caused by rapid cerebral hypoxia or anoxia, meaning a reduced or absent supply of oxygen to the brain, due to an accidental or non-accidental cause. Diagnosing asphyxial death is one of the great challenges in forensic pathology. Depending on the specific mechanism, there may be no lesions at all, and even when lesions are present, they are often nonspecific and can be seen in many other causes of death. The classic signs once thought to be hallmarks of asphyxia, the so-called obsolescent quintet of cyanosis, fluidity of the blood, visceral congestion, right ventricle engorgement, and petechiae, are now largely refuted as unreliable. Most of these are common post-mortem findings unrelated to the cause of death. Of these signs, petechiae, which are small, pinpoint hemorrhages, are the most compelling indicator of fatal neck compression, though they are still not definitive. They are thought to form when pressure on the neck veins obstructs venous return from the head, while arterial blood flow continues, leading to a rise in pressure that ruptures tiny blood vessels. They can be seen in the conjunctiva of the eyes, the skin, and the oral mucosa. However, petechiae can also be caused by other things, like severe coughing or coagulation disorders, and can develop in dependent areas of the body after death due to the simple effects of gravity. Given these diagnostic difficulties, a definitive diagnosis of asphyxia usually requires compelling evidence from the post-mortem examination combined with information from the history or the death scene. Forensic pathology classifies non-drowning asphyxia into three main categories: strangulation, suffocation, and mechanical asphyxia. Strangulation involves pressure on the neck, which can be from a ligature tightened by the body's own weight, which is hanging, a ligature tightened by another force, or manual pressure from hands or limbs. Death can result from either airway obstruction, vascular obstruction, or both. Here we must pause to discuss a critical point of comparative physiology. Much of the human forensic literature on strangulation is derived from experiments on animals, primarily dogs, yet the physiological responses are not the same. This is a vital distinction that veterinary pathologists must be aware of. The blood supply to the brain is significantly different in dogs and cats compared to people. In humans, the brain is supplied primarily by the internal carotid and vertebral arteries, and compression of the carotids causes rapid unconsciousness because the vertebral circulation is insufficient to compensate. In dogs and cats, however, the maxillary and vertebral arteries contribute significantly to cerebral blood supply, and there are numerous extracranial anastomoses. This makes them far less susceptible to cerebral ischemia from neck compression. In fact, dogs can survive the simultaneous ligation of all their common carotid and vertebral arteries without developing neurological deficits. The resistance of animals to various kinds of asphyxia is greater than that of man. This means that consciousness is maintained for longer periods, and the onset of death is often later in animals than what is described for people. An animal subjected to strangulation will struggle, sometimes violently for several minutes, before losing consciousness. This extended period of suffering has profound implications for animal welfare. Lesions of strangulation in animals can include a ligature mark or furrow in the skin, which may be hidden by fur, as well as abrasions and contusions on the neck. Internally, there may be hemorrhage in the neck muscles and, occasionally, fractures of the laryngeal hyoid apparatus. The second category is suffocation, which encompasses several mechanisms. This includes choking from an internal obstruction of the airway, like a foreign object lodged in the trachea. It also includes smothering, which is an external obstruction of the nose and mouth. This can happen accidentally, such as a cat becoming entrapped in a pet food container, or intentionally, such as an animal having its muzzle taped shut. Suffocation also includes death in a confined space or entrapment, where the available oxygen is depleted. For example, calculations show that a cat in a 15-liter airtight plastic container would consume all the available oxygen within about 18 minutes, and likely less due to physical exertion and rising temperature and carbon dioxide levels. Finally, suffocation includes death in a vitiated atmosphere, where oxygen is displaced by other gases. The most important of these in a forensic context are the chemical asphyxiants, particularly carbon monoxide and hydrogen cyanide, which are often produced in fires. Carbon monoxide is lethal because it has a much higher affinity for hemoglobin than oxygen, forming stable carboxyhemoglobin and preventing oxygen transport to the tissues. This poisoning is often associated with a characteristic, though not always present, cherry red coloration of the blood and tissues. The third category is mechanical asphyxia, which occurs when respiration is restricted by external pressure on the chest or abdomen, or by an acquired posture. Positional asphyxia happens when an animal is trapped in a position that compromises its ability to breathe, for instance, if it becomes wedged in a narrow space. Traumatic asphyxia, or crush injury, involves external compression of the chest or abdomen by a heavy object, physically preventing respiratory movements. Lesions in these cases can be nonspecific, but there may be marked congestion and petechiae in the body cranial to the site of compression. From the silent threat of a vitiated atmosphere, we now move to another form of asphyxia, one that involves a liquid medium, drowning. Determining the cause of death in an animal recovered from water is one of the most challenging tasks in forensic pathology. The central question is always, was the animal alive when it entered the water? An animal found in water may have drowned, but it could also have died from other causes, natural disease, trauma, hypothermia, and then fallen into the water, or it may have been disposed of in the water after death. For this reason, the diagnosis of drowning is almost always one of exclusion, relying on a combination of post-mortem findings, information from the recovery scene, and any available history. First, let's clarify our terms. Following a consensus reached by the World Health Organization, the modern definition of drowning is simply the process of experiencing respiratory impairment from submersion or immersion in liquid. The possible outcomes are death, morbidity, or no morbidity. Older terms like near drowning, dry drowning, and wet drowning are no longer recommended, as they created confusion. The process of drowning is a complex and terrifying sequence of events. The central mechanism is a rapid and persistent lack of oxygen in the blood, or hypoxemia, that begins as soon as liquid enters the airway. Upon submersion, an animal will typically hold its breath. Contact of water with the larynx triggers a reflex laryngospasm, closing the airway. During this time, the animal struggles violently, attempting to breathe against a closed glottis and swallowing large amounts of water. As oxygen levels plummet, the laryngospasm eventually relaxes due to unconsciousness, or the animal is forced to gasp for air, leading to aspiration of water into the lungs. This is followed by convulsions, vomition, and finally, cardiac arrest, with death typically occurring within 5 to 10 minutes of submersion. It is a process that involves intense physical exhaustion and the severe physiological distress of air hunger. For these reasons, drowning is considered an inhumane method of killing and is not an acceptable form of euthanasia. The physiological changes that occur during drowning depend on the type of water aspirated. Drowning in freshwater versus saltwater creates very different effects. When freshwater is aspirated, its hypotonic nature causes it to be rapidly absorbed from the lungs into the bloodstream. This leads to hemodilution, a dangerous increase in blood volume known as hypervolemia, and significant electrolyte imbalances, particularly hyperkalemia or high potassium levels, which can trigger fatal cardiac arrhythmias like ventricular fibrillation. Furthermore, freshwater washes out pulmonary surfactant, the substance that keeps the tiny air sacs, the alveoli, open, leading to their collapse and further impairing gas exchange. Saltwater, being hypertonic relative to blood, has the opposite effect. When aspirated, it pulls large volumes of fluid from the circulation into the alveoli, causing rapid and severe pulmonary edema. This leads to profound hypoxemia, but unlike freshwater drowning, it results in hemoconcentration and does not typically cause hemolysis or ventricular fibrillation. Per unit of volume, aspiration of seawater is more lethal than freshwater. The macroscopic lesions of drowning can be characteristic, but none are entirely specific to drowning. The most classic finding is the presence of abundant, stable froth in the trachea, mouth, or nasal passages. This foam is produced by the mixing of air, water, and pulmonary secretions during the agonal gasping phase and can only be produced by a live animal. The lungs themselves are often heavy, distended with water, and fail to collapse when the chest is opened. They may show areas of congestion, hemorrhage, and emphysema. Finding foreign material, such as sand or algae from the drowning medium, deep within the small airways is also a strong indicator of aspiration while alive. Ancillary tests have been explored to aid in the diagnosis, but most have proven unreliable. Perhaps the most famous and controversial of these is the diatom test. Diatoms are microscopic, single-celled algae with silica shells that are found in most bodies of water. The theory is that if an animal drowns, diatoms will be aspirated into the lungs, cross into the bloodstream, and be deposited in distant tissues like the bone marrow. Finding diatoms in these tissues would therefore confirm drowning. However, the test is plagued by issues of low sensitivity and a high risk of contamination, and diatoms have even been found in the tissues of individuals who did not drown, likely from ingestion of food or water. Its application in veterinary cases requires much more rigorous validation. Ultimately, the pathologist must conduct a thorough examination to look for these characteristic findings, while also searching for any other injuries or natural diseases that could explain the death. The silent testimony of the body, combined with clues from the environment where it was found, offers the best chance of reconstructing the animal's final moments. From the extremes of water, we now turn to the extremes of temperature. Thermal injuries, caused by exposure to excessive heat or cold, present their own unique set of challenges for the forensic pathologist. Let's begin with injuries caused by heat. These can be categorized as dry heat injuries, or burns, and wet heat injuries, or scalds. Dry heat injuries are caused by contact with sources like open flames, hot objects such as a stove or car engine, or radiant heat from a fire or heat lamp. In a forensic investigation, it is crucial to determine whether the animal was alive when it was exposed to the fire. This finding can have serious criminal implications, helping to differentiate an accidental death from an intentional act of cruelty or an attempt to destroy evidence of another crime. Burns are classified by their depth, using a system of degrees. First-degree burns are superficial, affecting only the epidermis and causing redness or erythema. Second-degree or partial-thickness burns extend into the dermis. Unlike in humans, the skin of dogs and cats does not typically form blisters, except in a few specific areas. These burns involve epithelial necrosis, dermal edema, and an inflammatory response. Third-degree burns are full-thickness, destroying the epidermis, dermis, and all adnexal structures like hair follicles. The skin becomes a leathery, painless eschar because the nerve endings have been destroyed. Finally, fourth-degree burns involve carbonization, where the damage extends into the subcutaneous tissue, muscle, and even bone. The severity of a burn is also judged by the total body surface area it affects. While the rule of nines used for humans is not perfectly accurate for animals, it can provide a rough estimate. Generally, burns covering more than 20% of the body surface are at risk of causing life-threatening metabolic problems, and burns approaching 50% are often considered incompatible with survival. So, how does a pathologist determine if an animal was alive during a fire? There are several key pieces of evidence. The single most reliable sign is the presence of soot deep within the respiratory tract, in the trachea, bronchi, and even the alveoli. This indicates that the animal was breathing while smoke was present. Soot can also be swallowed, and finding it in the stomach or duodenum is also considered evidence of life during the fire. Another vital piece of evidence is the presence of carboxyhemoglobin in the blood. Carbon monoxide is a toxic gas produced during incomplete combustion, and its presence in the blood proves the victim was inhaling smoke. Inhalation of hot air itself also causes characteristic damage to the airway mucosa, including epithelial necrosis and edema, which are also signs of antemortem exposure. The absence of these signs, however, does not rule out exposure to fire, especially in cases of rapid flash fires where death may be instantaneous. It is also critical for the pathologist to distinguish these vital signs from post-mortem heat damage. A body exposed to fire after death will exhibit a range of artifacts that can mimic traumatic injury. Heat causes body fluids to vaporize, creating steam that can cause the skin to split and the abdominal cavity to rupture, which could be mistaken for a stab wound or blast injury. Heat also causes muscles and tendons to contract, pulling the limbs into a flexed position known as the pugilistic attitude or boxer stance. In the skull, heat can cause the formation of an extradural heat hematoma, a collection of cooked, granular blood in the epidural space that must be differentiated from a true traumatic hematoma. Wet heat injuries or scalds are caused by hot liquids or steam. Morphologically, they resemble burns, but can be distinguished by their distribution patterns and the lack of singed hair or carbonization. Hot liquids often create sharply delineated flow lines down the body, with the most severe damage at the point of initial contact. Immersion scalds are characterized by a straight, linear border between the affected and unaffected tissue. Now let's turn to the other extreme, cold injuries. Local cold injury, or frostbite, is caused by the freezing of tissues at temperatures below 0 degrees Celsius. The damage occurs through two main mechanisms: direct damage from the formation of ice crystals within and between cells, which disrupts cellular structures, and indirect damage from circulatory changes, including intense vasoconstriction, blood sludging, and the formation of thrombi, leading to tissue anoxia. Like burns, frostbite is graded by severity. First-degree frostbite involves numbness and redness upon rewarming. Second degree involves the formation of painful blisters. Third-degree frostbite is characterized by full-thickness necrosis of the skin and subcutaneous tissue, forming a black, dry eschar. And fourth-degree frostbite involves complete necrosis and dry gangrene of all tissues, including muscle and bone, leading to loss of the affected part. The areas most commonly affected in animals are the distal extremities, the ears, tail tip, scrotum, and digits. In birds, the feet and the tips of the wings are particularly vulnerable. Diagnosis relies on a combination of the morphological findings and a history of exposure to cold temperatures. We have covered a vast and complex landscape of injuries. But to complete our picture of veterinary forensic pathology, we must touch upon a few more specific case types that pathologists frequently encounter: projectile wounds, starvation, and the particularly sensitive topic of animal sexual abuse. Let's start with projectile wounds, which can be caused by firearms, air guns, or arrows. The objectives of the necropsy are to identify the entry and exit wounds, document the internal damage, recover the projectile if it is still in the body, and, if possible, determine the direction and range of fire. Entry wounds are often circular or oval with finely abraded margins. Exit wounds, in contrast, tend to be larger, more irregular in shape, and lack an abrasion margin. These differences arise because a bullet is traveling straight and fast when it enters, but it loses energy, tumbles, and may fragment as it passes through the body, creating a more disruptive exit. The diameter of the skin wound is not a reliable indicator of the bullet's caliber. A critical piece of information can be found by examining the margins of an entry wound for beveling. This is an abrasion formed if the projectile strikes the skin at an angle, indicating the direction from which the bullet came. This can be crucial evidence for confirming or refuting a shooter's account of events, such as a claim of self-defense against an attacking dog. For firearms that use gunpowder, the range of fire can sometimes be determined. A contact-range shot, where the muzzle is pressed against the body, will leave soot that can be wiped away. A close-range shot, typically less than 0.6 meters, may leave a pattern of punctate black spots of unburned gunpowder called stippling, which cannot be wiped away. Distant shots leave no such marks. Detecting these on a furred animal is, of course, a major challenge. Arrow wounds differ significantly from gunshot wounds. Arrows slice cleanly through tissue and hair, creating an incise-type wound, whereas bullets crush and tear tissue. Another common type of forensic case involves neglect, often culminating in starvation. Here, the goal of the necropsy is to document the animal's condition and, critically, to rule in or rule out any concurrent disease that could account for its emaciated state. The term starvation should be used when a necropsy rules out these endogenous or internal causes of weight loss. The post-mortem examination can only rule out disease. It cannot prove that food was willfully withheld, which requires information from the scene investigation. The findings in a starvation case are stark. They include a severely reduced body condition, meaning a loss of both adipose tissue and skeletal muscle. A standardized body condition scoring system should be used for an objective assessment. Internally, the pathologist documents the loss of fat from visceral stores like the omentum and around the kidneys. The last fat reserve to be used is in the bone marrow, and the presence of serous atrophy of bone marrow fat, where the fat is replaced by a gelatinous material, is a hallmark of emaciation. The gastrointestinal tract is examined for its contents, noting the presence of any food or non-food items like sand or debris. Finally, we must address the difficult subject of animal sexual abuse. This involves any sexual contact between a person and an animal for the purpose of human sexual gratification. These cases require a highly methodical and sensitive approach to the forensic necropsy. The examination begins even before the first incision, with an alternate light source examination. Certain biological fluids, including semen, can fluoresce under specific wavelengths of light, helping to identify areas for evidence collection. Evidence collection is paramount. The animal is combed for foreign hairs. Nail clippings are taken as they may contain the perpetrator's deoxyribonucleic acid from scratching. Swabs are collected from the oral cavity, rectum, and genitalia for deoxyribonucleic acid analysis. Vaginal and rectal washes can be performed to collect trace evidence, including spermatozoa or lubricants from condoms. The physical examination looks for injuries to the anus, rectum, and genitalia, such as tears, dilation, or the presence of foreign bodies. However, victims may not have any visible injuries. The pathologist also looks for other, non-sexual signs of non-accidental injury, such as bruising, fractures, or evidence of strangulation, as sexual abuse is often accompanied by other forms of violence. Specialized screening tests exist for identifying human seminal fluid, but many of these have not been validated for use in animals and must be used with caution, with confirmatory testing performed by an accredited forensic laboratory. From the microscopic analysis of a hair shaft to the complex interpretation of a three-dimensional computed tomography scan, veterinary forensic pathology is a field that demands a vast breadth of knowledge and an unwavering commitment to scientific objectivity. The cases are often heartbreaking, but the work is profoundly important. By meticulously gathering, documenting, and interpreting the evidence, forensic pathologists give a voice to the victims and provide the courts with the objective information needed to pursue justice. The field is still young, with a great need for further research, standardized procedures, and collaboration between disciplines. But as it continues to grow, it strengthens our ability to protect the most vulnerable among us and to better understand the complex and often dark connections between cruelty to animals and violence in our society. Thank you for listening. The titles for the referenced papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.